I've tried to avoid talking about the coronavirus for a while because it's just gotten annoying and stupid. But recently, the CDC quietly released a little study that they did that shows that 94% of all of the deaths attributed to COVID had some sort of underlying medical condition, a comorbidity, as they call it. So, a comorbidity is defined as more than one disease or condition being present in the same person at the same time. Conditions described as comorbidities are often chronic or long-term conditions. And as this says, only about 6% of all deaths can be attributed purely to the COVID-19 infection. Some people are saying that, this doesn't change anything. Yes, it actually changes a lot of things, because what this is saying is if you are a relatively healthy person, at any age, really, yes, there's heightened risk for people in certain age groups, but the likelihood of you dying from this is very, very low. I would be really curious to see also, in that 6% who died only from COVID, I would be really curious to see the age breakdown, because my guess is that a very high percentage, I would bet even over 90% of the people in that group, which comes out to about 10,000 deaths, I would bet that the vast majority of the people in that 6% are elderly people. Now look, I don't want anyone to die from this. I don't want people to get sick. I'm not saying this to be like, I don't care. But we have to be rational about the way we deal with these things, and we clearly haven't been. Another thing that kind of upsets me too, among the quote-unquote medical conditions linked with COVID-19 deaths, the list has things like influenza and pneumonia, respiratory failure, hypertensive disease, diabetes, vascular and unspecified dementia, cardiac arrest, heart failure, and renal failure. Okay, those are all real diseases, and I'm not saying that having the COVID-19 infection couldn't irritate those things and make them worse. That is a possibility. But here we have intentional and unintentional injury. Intentional injury is being counted along with the COVID deaths? You mean suicide? And, car accidents or falling off a house or something? Intentional and unintentional injury. Poisoning and other adverse effects. What they were saying is if you even had any trace amounts of COVID in you, and you fell off a house, or you decided that life wasn't worth living anymore, and you tested positive for COVID, they were counting you among the dead for COVID. That is so utterly dishonest. There needs to be an investigation into this or something. I don't know, but this is upsetting, because for the past 6 months we have been told that locking ourselves down, wearing masks, and doing all kinds of things, and just going, what's going on? We've been told that this is helping, even though it seems like this isn't as deadly as they've said. I'm not saying it's not. But, yeah. Not to mention that the New York Times is reporting now, this is from just a couple days ago, that potentially 90% of all those who've tested positive for COVID-19 have had such insignificant amounts of the virus present in their bodies that such individuals do not need to isolate, nor are they candidates for contact tracing. 90%. 90%. Potentially 90% of all positive cases could be false. Here's a quote from the New York Times. Most of these people are not likely to be contagious, which I could have told you a few months ago when the World Health Organization said that during their contact tracing for those who are considered asymptomatic, they didn't find any asymptomatic spread. But most of the people are not likely to be contagious, and identifying them may contribute to bottlenecks that prevent those who are contagious from being found in time. My goodness. For the past few months, we have been told time and time again from the media and politicians that doing all this is going to solve the problem because there's going to be tons of deaths. Everyone's going to die in the streets. Everyone and their grandma's going to get killed. You're killing grandma if you don't wear a mask. Even though, according to this, the number of people who have died purely because of the virus is around 10,000. And that's not good. I don't want that to happen. But that's a lot lower than the 2 to 4 million that they said were going to die. Since maybe the past few months, the data has shown a steady drop in death rates, too. As of right now, according to the numbers given, the death rate in the U.S., as far as I can tell, is around 3%. And in my state, it's less than 1%. Why are we doing this? Beyond politics. Because the only thing I can see is that this is about politics. Anyway, I just want to leave it there and just say again, 94% of all those who have been among those who've been considered among the COVID deaths they had some sort of comorbidity, meaning they were already not healthy. They were already at risk. They were in the high-risk category. Only 6% actually died purely from the virus. And yet the media has been saying that the likelihood of people, children, young adults, anyone, they're acting like it's the 1918 pandemic. Anyway, this is just ridiculous.